What a sorry state of affairs then, as we had reported 2 years ago and today as well. The Bungoma Referral Hospital is in a dire state, and the patients who are going there are in a similar condition. Now, joining us to discuss this is a representative of some of the health workers who have been on strike since Thursday, Dr. Oluga Uma, the Secretary General of the Kenya Medical Practitioners and Dentists Union. Thank you very much for joining us.
Thank
you.
Now,
looking at the hospital, we've reported on this twice now, and the optics are quite shameful, lending itself to a public perception that doctors are quite ambivalent to the suffering of patients there. Is this the case?
Thank you very much, John Alam, for inviting me to KTN. To say the truth, I think it's the counties and the country that is ambivalent to the suffering of patients. We have said time without number the issues that are affecting healthcare, and we know them. Bungoma County is actually just a symptom of the bigger problem in healthcare in this country, and quite a number of counties are actually going through the same problem as Bungoma County. Tharaka Nithi, Uasin Gishu, quite a number of counties, and the elephant in the room is the way healthcare workers have been handled, and in particular doctors.
Yes.
In Bungoma County, in Tharaka Nithi, all healthcare workers are actually out of hospital because some of them have worked for up to 3 months without pay. And if, as it is, the pay that healthcare workers get is so meager that if it even delays for a month, then you are unable to even meet the basic human rights, like housing, like food.
That's understandable, Dr. Uma, but aren't there other options? Couldn't you have gone on a go-slow, for instance, so that the operations at the hospital continue, instead of leaving patients sleeping in the same halls as corpses?
We have actually been very patient with the counties. We have been very patient even with the national government. As a matter of note, is that the healthcare workers are actually the only humane people remaining working in the counties, because it looks like the county governments, and especially with their governors and the people who are working, do no longer care about healthcare workers. You note that Tharaka Nithi CC actually even told healthcare workers to go on strike. The same with Uasin Gishu governor. When it has become so careless upon the leaders who are supposed to take care of the health of their people, telling healthcare workers and talking to them in a very arrogant and ignorant way.
All right, then there might be arrogance, and there might be ignorance.
Coming back to your question about are there other means? Yes, of course there are other means, but counties have been running away from dialogue. Healthcare workers have sought to talk to them for quite a number of times. By the way, we have actually had a lot of engagements. So far, we've had over 25 engagements with the Council of Governors, and I can say that we have written letters to them, we have met them, we have talked, but the same issue of pay. Okay, number one, the pay is so it's almost like you're working on a volunteer basis.
Yes.
Okay, number two is that pay does not come consistently.
But the complaint of the governors,
the issues of the promotions,
Dr. Uma, the issue of payment, especially throughout Tharaka Nithi, Jackson Mandago from Uasin Gishu has spoken on the same issue, and I believe it's the same in Bungoma, is that money has not been transferred to them by the national government. Is this, to the best of your knowledge, true? Have you investigated it? Are you involving the Ministry of Health in these discussions to ensure that the pay reaches at the time that it's supposed to?
Healthcare has failed at both levels of the national government and at the county governments. But remember, the county governments have been very enthusiastic to take this function of healthcare. And if they want to be successful with the function of health, then they must make sure that they meet every single obligation that goes with that function. That obligation includes the obligation to pay healthcare workers. And if they have problems with the national government, that is their problem. Healthcare workers should not be the people that bear the brunt of infighting between national government
but
and county governments.
seriously speaking, Dr. Ouma, it's not just healthcare workers who are bearing this brunt. It is the patients as well,
exactly,
who are right at the end of that service delivery chain.
In fact, actually, the patients are the ones that are bearing the greater part of the pain that comes with this infighting. And that is where the governors come in, because they are the ones that were elected by their people, and their people are dying. Right now we have almost 420,000 deaths annually, which is a double from 2 years ago. Okay, we are losing over 1,000 patients who we shouldn't be losing, because healthcare workers are either not there, most of them have resigned, majority of them are demoralized, most of them are not paid. Doctors right now, you saw the story of 700 doctors that are being mishandled at the counties that were posted. 2 months down the line, April, May, they have not been paid. How are you supposed to pay your rent? How are you supposed to feed? And if counties want to show that it's the national government that is not giving them the money, then let that national government take the function of human resources.
All right.
Because so that they pay in time, so that they promote these workers, so that they pay them better.
Okay, well, let's move forward. How far are health workers willing to go with respect to this strike, and what solutions can we expect for the patients who in the midterm are suffering, many of whom are reported to be dying? Very quickly, as we're running short of time.
It's very unfortunate that patients actually are really suffering. Healthcare workers have actually always been there to give their services, even in very strenuous conditions like in Peketoni and in Mandera. The solutions are as clear as we've talked about them. If the counties are unable, and they have shown many times that they are unable, with healthcare workers resigning, 2,000 doctors have actually resigned. They have not been able to pay doctors. Right now, ethnicity and tribalism is the in thing in the county.
To your solution?
Yes. Now, the solution is the counties should accept that they have failed. They have failed. And we have seen that. This function of human resources, the counties can paint the hospitals, they can put equipment, they can do whatever they want.
So you'd like the function of health to be returned to the national government?
Resources, management should be at a central point.
All right. So the national government should take care of this.
Exactly.
All right.
Exactly.
All right, that's where we're going to have to leave it, Dr. Ouma. Thank you very much for joining us. That's been Dr. Oluga Ouma from the Kenya Medical Practitioners and Dentists Union, speaking about the state of affairs, just starting with Bungoma Referral Hospital, but also through about 5 counties where health workers have been on strike. Let's move on.